of Quality and Accreditation Institute and Consultants Consortium of Chennai. I, Rehma Javed, the Deputy Manager of QAI, welcome you all. Those who all have joined us today in this November month quality series, 30th November 2024. Since we are celebrating and embracing this theme for this year, quality from compliance to performance, we would like to begin with the topic for today's webinar, quality and compliance in healthcare delivery, shift in focus from compliance to performance, delivering quality care. But before we begin, let us have an opening remarks from Ms. Rama Venugopal, who is right here with us. Ma'am, I would like you to take over and give us something about the topic.
Thank you. Thank you, Rema. Welcome to all the speakers and the delegates for today's session. So this month of November is known as Quality Month across the globe. So throughout this month, from our consultants forums, we have a Consultants Consortium of Chennai and Management System Consultants Consortium. We have been conducting a series of knowledge sessions for various sectors on the topic of quality, safety standards, and sustainability. The first 2 weeks, we had multiple sessions covering manufacturing quality, and the last 2 weeks is covering multiple services sectors. And each sector's conversation is actually related to global theme. So every year when the Quality Month is celebrated across the globe, a theme is released, and generally we find conversations happening around this theme. The themes are designed and decided based on the market needs. So the theme this year for this Quality Month is to shift the focus from compliance to performance. So when we talk about quality management systems and quality standards, certifications and accreditations, and multiple various other compliance tools related to standard certifications, the businesses need to shift their focus from looking at all this management systems or structures or programs or standards merely from a compliance perspective, and then the focus should be extended from there, and maybe the next version of this quality focus is to build an effective performance management systems, structures, and strategies in the businesses. So based on this conversation, for each sector, we have more or less designed a conversation around the same topic. And so today is the session for healthcare services. I'm sure this is our 14th or 15th session. I don't remember the number exactly. So today's session also on healthcare services is how do we bring that focus from compliance to a performance orientation. Yes, we do have certifications, accreditations, and various frameworks, domestic, international, and the latest one in the healthcare quality management system in the global market, which was released last year, is also an ISO standard for healthcare quality management system, which is slowly receiving global acceptance and recognition. So with so many programs, so many standards, so many tools, still the market perception is when we talk about the quality, it is kind of looked upon as a from a compliance perspective, some tick box kind of an engagement. Somebody is asking, let me comply with this kind of a mindset is what that is being developed generally across all the sectors. So that is the reason why we have created a conversation by inviting multiple stakeholders from the industry to bring their perspectives and their thought processes on this topic. So I really welcome you all once again from Consultants Consortium of Chennai and Management System Consultants Consortium. Thanking all the speakers and the audience. And let us listen to what the speakers have got to say. And all this session recordings will be shared with almost all the stakeholders in the industry and the healthcare sector to kind of convey this message from the speakers, their thought processes, which will help organizations, healthcare businesses to take a relook at their internal strategies and try to focus on building that kind of a balance and connect between quality compliance and also with a performance improvement focus and outlook. So with that, I will stop here and I will hand over the session back to Rema. Please take it forward, Rema. Thank you.
Thank you. Thank you so much, Rama ma'am, for briefing us about the topic and the whole series on this theme for 2024, quality from compliance to performance. So, as we all know that this topic is quite pivotal and challenging for all the organizations, not just in healthcare, but non-healthcare as well. So, like we all know that we are complying to the standards, like we want to surpass the performance goals. So it's not just it is a call to action, like we are transforming ourselves from quality, from basic requirement into a whole beacon of excellence and innovation. So a very well apt theme for this time. Thank you so much once again, everyone who have joined us. And moving on, we would like to welcome our distinguished speakers who are going to share details further specific to this theme, and they're going to help us gain more knowledge than we already know. So I would like to share my screen, welcoming all our speakers. I hope my screen is visible.
Yes.
Welcoming Mr. Gaurav Brahmbhatt, who is the founding member of Healthcare at Home. He has over 20 years of experience in healthcare and pharmaceutical industry with a strong background in pharmacy, biotechnology, and business administration. Carrying on with his passion about creating physical and digital care, helping patients achieve complete control over their diseases. He has successfully partnered with global pharmaceutical MNCs such as Novartis, Abbott, to launch innovative patient support programs that increase therapy adherence and patient engagement. He has also built a network of pharmacies across India for the supply of specialty medicines and medical equipments. Additionally, he has delivered large-scale disease management programs across India, serving more than 2.5 million patients. So, welcoming Mr. Gaurav.
Thank you.
Then we have with us Dr. Clive Fernandez, who is Senior Vice President, Group Clinical Director, and Group Chief Operating Officer, Wockhardt Hospitals. So he has an experience more than 20 years in clinical care settings and administrative responsibilities. So for the past 11 and a half years, he's associated with Wockhardt Hospitals as the group's clinical director and is also responsible for driving all the activities related to clinical excellence, academics, research, and quality. He has worked at Apollo Group Hospitals for more than 7.5 years. He played a leadership role there. He promoted medication safety, implementing quality improvement initiatives. So, as part of the project management office, he was involved in defining and influencing the performance of various improvement initiatives undertaken across the group to increase operational efficiencies, thus positively impacting revenues. I welcome Dr. Clyde. Ms. Neha Lal, she will be joining us shortly, who is the healthcare management leader in Adani Healthcare. So she holds a strong record of contributions in streamlining operations, invigorating businesses, heightening productivity and procedures with rich experience of 19 years. She has a proactive change agent who spends time in employee environment, encouraging leaning and promoting the increased productivity that result in value-added services. She is a strategic professional who deploys participative management style in fast-paced and diverse workforce. She has ability to establish new business, lead operations, and work in multicultural environment and deliver sustained profitability and growth in dynamic conditions. Ladies and gentlemen, our speakers for today. Moving on to the agenda of this webinar, I welcome Dr. Clive to kindly share his views on the topic and leading us on the theme. So I request Dr. Clive to kindly take over the session.
Thank you, Rema, and good evening to all.
Rema, just confirm whether you can see my screen now once.
Yes.
I can see it, sir.
Yes.
Okay, so before I, thank you
Full, yeah.
to it's full screen now, right?
Yes. Clear
Yeah,
now.
so
Yes.
so thank you to QAI, thank you to Rama Madam and CCCI and all, for having me over here. And it's a very interesting topic and interesting subject. But when we said 20 minutes, we can talk about this for whole days. So I'm going to give in the next 20 minutes, I'm going to give a ball's eye, a bird's eye view of, how what I have some views on, on this above topic. So when I was first asked yesterday, can you talk about, balancing compliance and expectations and for quality in healthcare? I looked at Rema, I asked Rema, you mean balancing? You really mean balancing? Seriously? Are you really talking about, balancing between what we have to do and what we need to do? But then I realized, the world is always not what it looks like. So I was looking at the word, the topic was balancing performance versus expectations, quality healthcare. So I actually went into Google and said, okay, let me first understand what does quality healthcare mean? Now, quality healthcare, as per some definition, but it is there. So this is according to the National Academy of Medicine. It actually says quality healthcare is healthcare which is care that is safe, effective, patient-centered, timely, efficient, and equitable. And I said, okay, this gives me a subjective definition of what it is. Then I sat back myself and I said, okay, as a leader, as a healthcare leader, or as a stakeholder, what would quality healthcare mean to me? Because if I have to talk about compliances and performance, I need to understand what it actually means to me. And then I got, it said quality healthcare actually meant one thing: parameters, clinical outcomes, which are good, better, best, the good, best clinical outcomes, focusing on patient safety. We all know, we have heard that a lot of times, primum non nocere, do no harm. But what do we mean by this? So quality healthcare is excellent clinical outcomes, guaranteeing patient safety all the time. And now there is a new thing, in the last 3-4 years and for going forward, I think managing patient satisfaction. So this is the three things. And then I looked at what the Google said and what me as a person thinks. So what is there in theory and what we think practically as healthcare leaders, I found there is no difference. So I came to the second part of the topic, C&P. Now, what is C&P? The topic was compliance, balancing compliance. So a layman's language, definition of compliance is what is required. Normal requirement compliance is what is required. Jo jarurat hai. So as in healthcare, as per good clinical practices, as per accreditation requirements. And the other thing was performance. So first is what is required vis-a-vis what we do. In an ideal world, I heard so many of you, most of us, including me, was yesterday thinking, why should the C not be equal to the P? How is it possible that compliance is going to be something different and performance is going to be something different? Because in an ideal world, and the key word here is ideal, C should be equal to P. And we all know what black and white means. It either means you do it or you don't do it. You're completely either on one side or another. There is no intermediate state. A simple choice between two opposite things, good or bad. But this is theory. Life has also taught us that this is theory. Life is not always so simple. Imagine, this is another slide is on dreams versus realities. What we want when we toss the coin, even when we toss a coin, we said, okay, heads, this will come, tails, this will come. But when we toss the coin, we already are thinking what we want. But that is our dream. In reality, what happens? What we get in life, we are faced with options where, we always have to have a middle path, which has nothing to do with the head or the tail. And that's where I realize, oh, yeah. So, here the word balancing between compliances and performance, that is important. So when we talk about healthcare and we talk about compliance, compliance is all about statutory and accreditation. And before we go into compliance, accreditation has helped us a lot. It has helped everyone in healthcare, we know it, but it has also brought three unwanted byproducts. And I coined them as the three syndromes that have infected healthcare settings. And what are these three syndromes? The QDJ syndrome. It's the quality department's job syndrome. Anyone who asks anything is the quality department's job. Secondly, the red light syndrome, which I will show you in the next slide. And then third is the WPD syndrome, Bo Pansden syndrome. So what exactly does this mean? I'll ask your audience, I'll ask Rama, Madam, Rema, all the audience today. At 4 a.m. in the morning, how many of us will stop at the red light? On an empty road at 4 a.m. in the morning, how many of us will?
Unsupervised.
No. Yeah, it is at 4 a.m. How many of us will stop at the red light? No one.
No.
Now, this is my friend who has come. Now at 4 a.m., how many of us will stop at the red light? And whether people like it or not, everyone will stop. So, there is something called compliance and something called performance. Now, how do we balance this? Look at this. This is the compliance of a healthcare organization to all the standards, the safety standards, accreditation standards. And you see, the performance keeps waxing and waning every 18 months to 3 years. And what is that? This is the WPD syndrome. These Bo Pansden, because it is at this time that they are having their accreditation survey. So accreditation has helped, but the inconsistency in between is worrying. But then I realized, as I told you, there is no black and there is no white. And now we have to actually think of a balance. So very important when we talk about balancing and we talk about healthcare and we're talking about safety, it is very important to understand what you can balance and what to balance, when to balance it and where to balance it. This is very important. If we are actually saying there is a shade of gray, we have to choose that shade of gray very, very carefully, because the wrong choice could impact outcomes and, for a patient, which is something we do not want. So how to balance the fine line? It is a very thin line, a very fine line. And how would we balance it? Very, very clearly, we have to lay some ground rules. And the first ground rule is define the non-negotiables. Even when you're balancing, even when we are saying we are going to compromise or we are going to cut corners, something that I would never tell someone to do, we have to be very clear on the non-negotiables, the things where we will not even think of balancing. Now, when we define things, we all know people don't do what is expected. They do what is inspected. And when we inspect, we find there are violations. Very important to address the if not, then what. And people who know me for a long time, they would find it strange that I'm actually talking about balancing. For me, it has always been you need to do it. But in an ideal world, that's what it is. But in a real world, you have to, find the real mix between, how to do things. But the third point is even something which is negotiable when it is healthcare, when it has to do with the life of my patient, with the outcomes of my patient, you have to keep raising the bar for the negotiables. I think these are the three, in 20 minutes, this is what I can give you. These are the three main things that you would need to focus on: the non-negotiables, address the if not, then what, and always keep raising the bar. So what do we mean by non-negotiables when we talk about healthcare, hospitals, quality, patient safety, outcomes? It has to be very clear there are no compromises on key processes which impact patient outcome and patient safety. If you ask me what are those key processes, I can write a book. So I'm just giving you an example because no 5 fingers are alike and each person has to define what is important for them. But in a healthcare setting, statutory licenses, never cut corners with this. Never cut corners with your statutory requirements. It's a non-negotiable because that is the thing in the first place which allows you to function the way you're functioning. We hear so many times, wrong patient, wrong site, wrong surgery. It is very common nowadays. In the West, we have had accreditations for 70 years, but these things still happen, which actually convinced me to do this talk today that, till the day comes where all this is gone, we have to define to people how to balance. But things like timeout, where the person who's doing the procedure, who he should be there, because most of the time the person who's supposed to do the procedure is the only person not participating in the timeout. And when he comes, he does not know what is the surgical site. The person who marked the site did not know what is the organization site. So he puts a cross. Now, a cross normally means don't do. Now, this surgeon uses a cross in his private practice. He comes up, puts a cross on the left inguinal side for a left inguinal hernia. And when someone is operating it, they look, the resident has put a cross on the left side. The operating surgeon doesn't know. He sees the cross on the left side. He operates on the right side. So you end up doing the wrong thing. Medication errors. The whole world talks about medication errors and how it is harming patients. It's one of, medical errors, including medication errors, as one of the top 3 causes of death in the US. It could be, if we all say, all our nursing people say, we practice the 5 hours very diligently before medication administration. We are checking the correct patient. We are checking the correct dose, for the correct route, for the correct frequency. If this actually happened the way it is supposed to happen all the time, believe me, you could have a prescribing error, you can have a dispensing error, but because you're checking it before it is being given to the patient, you will never have an administration error. But still, we read so many times about medication errors, near misses. So, this is one of the things I would say is a non-negotiable, because this is done so many times a day, and a wrong medication could cause harm. PSV, credible primary source verification. We have so many fake doctors. I know of a particular friend of mine who in one state is actually after these people, and he's getting a lot of people who claim to be what they are, and they are not that. So a credible source verification for the credentials of your doctors is very important, because when you have someone who says they are a surgeon, or they are someone who they are not, and they actually operate or do something, they could cause more harm. We have defined clinical practice guidelines. We have defined clinical pathways. But the problem is, we do this or we document this only for the accreditation. Now, remember, if we want safe outcomes, if we want great outcomes, if we want good outcomes, we need to practice these clinical practice guidelines and protocols the way they are defined. This is one very close to my heart, because even today we see, so many bad things happening in hospitals because of fires. And then people come to know there was no fire audit. But, a lot of times lives are lost in hospitals which are accredited, which have licenses, which have done everything. But that was not done. It was only done on paper. So these are non-negotiables, and I could go on. If you give me 2 days to talk on only non-negotiables, I'll tell you I would still need more time. But we have to define some processes where we say compromise is a no-no. Second, addressing the if not, then what? Remember I said the WPD syndrome, those 5 days, wo 5 din, where compliance actually went up to where it should be. It actually means and shows us that things can be done. So there is 2 things. It's a mindset issue. And the second thing is, if addressing the if not, then what? Oh, he's a top consultant. He's a top revenue owner, revenue grosser. Let us not talk to him about hand hygiene. Let us not talk to him about, patient identification. Why not? And what happens, when you say it has to be done and it is non-negotiable and people do it, is leadership willing to crack down? Leadership has to walk the talk. So addressing the if not, then what is very important. And here, the word I took out, the only word from the heading of the today's topic which are not spoken was the balance part. So yes, you will have to have a carrot and a stick approach to this. And the third point was keep raising the bar for the negotiables. Now, what are the negotiables? Because I am saying there is nothing that should be negotiable. It should always be there or not there. But let's talk about hand hygiene. Remember, quality is a journey. You are never going to reach, because once you reach one place, you have to go to another. You are never going to reach your destination. The moment you reach, the bar is raised. Hand hygiene. If you ask people to do, you want compliance 100% from day one, it is never going to happen. So if you say, if you're not 100%, you don't practice here, you'll have to shut shop. So you will start. On 1 year, they'll be 30%. Your bar should be raised that by next time we should be 40%. From 40, you go to 50. So this, when it talks about balancing between compliance and performance, these are the negotiables. Now you cannot have a black and white rule for things like hand hygiene, identification of patients, reporting incidents. We have to keep raising the bar and keep telling people to improve performance. So the three things that I think are very important is define the non-negotiables, address the if not then what, and keep raising the bar for the negotiables. Now, one thing which is very important nowadays, a customer, the patient, he is very important. And there are two very new kids in town, like the Eagles song on New Kids in Town. These are the two new people that we have in town, Prem and Prom. And why are these important and what are these? And so my last slide is about this. So what is Prem? Who is Prem? And a lot of people are always already thinking, oh, Prem. Yes, Prem. But I have to disappoint you. Though Prem is not Salman Khan. Prem is a patient's view of their hospital experience. Now, a lot of us take this and it's called feedback. But what do we do with this feedback? Because remember, I told you my three things in quality care would be great outcomes. One was customer satisfaction. If my customer is not satisfied, he is not going to come back. So focus on actually taking feedback and doing something about it. Prem, the important word is experience. E, Prom, the important word is outcome. You give a patient a medication for pain, then you don't say, oh, I've given him the medication, now his pain will go. You ask the patient, is your pain better? So that is a Prom. So next, then this is something that a lot of healthcare organizations need to keep focusing on. Engage your patients. You have to balance what you tell them, how you tell them, and when they tell them. It is the new trend going forward. It will also medically, legally help you, because if the patient, you do something which the patient says they're not informed about or they do not know about, we are going to get into trouble. Very simply, you don't do it because it's the new trend or medical legally it will keep you out of trouble. You actually do it because patients expect it. And they're educated nowadays. So in short, if we had to talk about in 15, 20 minutes, I have to tell you, yes, we can balance, we have to balance, between compliances and performances, because healthcare is a journey. But we have to also know where we should not balance. And those were the non-negotiables. Then we can have the negotiables. But remember, I don't want anybody at any point of time saying, oh, Dr. Clive said, we can define our negotiables and, we can balance, not do anything about that. The important point I'm putting here is when you have negotiables, you keep raising the bar on them. So with that, I think there's a question. How can Dr. Tushayu, good afternoon. Good afternoon. How can healthcare organizations balance the increasing burden of compliance reporting with the need to focus on quality healthcare? Administrative burden of compliance reporting. Now, what do you mean by administrative burden? See, compliance reporting has nothing to do with quality healthcare. Compliance reporting is statutory, and that you need to do. And I will tell you one thing. A lot of times, people say make checklist, make a form, make another form, because they say that will help. And then everyone says quality is more work. Quality never told you make a form or make a checklist. You need to do what you have to do. You define the way you have to do it. If you got a lot of resources, you've got deep pockets, you can keep 4 people, or you define a better way. And I'll take the second question before Emma shuts me off. Yeah. As a doctor, how can I manage growing administrative burden without compromising patient care? I know Dr. Tushayu personally, so I'll tell you, Dr. Tushayu, as an emergency physician also, you are the last person I can tell how to balance stuff, because if it was a physician who has a normal OPD hours, I can tell him shut off after some time. But you being an ER physician, you can get a call at a certain time. You have to go there. You might have to define how much time to take out for administrative stuff, and you might need to keep that time flexible. But believe me, when you're a practicing clinician who's in administration, You need to be very flexible, and your balance has always to be towards the clinical. Patient should never suffer. The admin work can take care of itself. You can take care of it later. I think that that's time up for me. Yeah.
Thank you so much, Dr. Clive. There were wonderful examples in your presentations, and we enjoyed it. I like the example of Prem Salman Khan. You made it very easy to, help us understand compliance to performance, and then how to balance both of them. So, thank you so much, sir. We are going to take away so many things from you. So, there are no further questions. We can move on to our next speaker, Mr. Mr. Gaurav Brahmbhatt, who is going to deliver a lecture on building a performance management system in healthcare. So, over to you, sir.
Yeah, sure. Hi, good afternoon. Thank you, Dr. Clive. Great insights, and I hope that I build it up from there. So just let me do the presentation. Please let me know if it's full screen.
Yes, it
Yeah,
is.
we can see it's clear.
All right, fine. So, I think let me start with this. Dr. Clive gave a very good example, Prem and Prom, and I guess I suddenly started reflecting back on that, and I thought that, oh, my presentation should try and build it up from there, and that's how I sort of try and narrate the story as well. So, without delaying, focus which I will be doing on this next 15-20 minutes is all about how we build up the performance management systems in healthcare. We by now we largely understand what we need to do and why we need to do. But a lot of the time when it comes to designing and which is exactly why or how is what I'm going to focus on. I'm Gaurav Brahmbhatt. I head the pharma business for HCH. I'm also the founding member for HCH in India. So briefly, what I'm going to talk about, and it might be a little bit of academic academic journey over next 15 minutes. But on top of academic journey, what I also believe that the work which HCH has done over last 12 years in India would sort of also try to give you some practical insights as to how we have done our journey. And maybe some of you are already on the path to journey, or some of you have just started, or some of you already have reached there. So I guess it will be applicable to all of us who are attending this fantastic webinar created by QAI and Ramaman. So quickly, what we're going to talk about is we're going to talk about performance management introduction and importance. In order to build up a tower, we need to have key components. So of course, we're going to talk about what are those puzzle pieces which we need to gather. We will also talk about, once we have those puzzle pieces, how do we stack them? How do we go step by step? And what should be our approach of building up a performance management system? And then we will talk about, the very popular word nowadays, whether it's matrices or whether it is KPIs or whether it is dashboards or whether it's data visualization, etc., etc. So this is a little bit more academic, but everybody knows that when we talk about performance management, we by and large we talk about setting up goals, we talk about measuring the progress or providing the feedback or making improvements. All this is what, whether it is a healthcare domain or whether it is a non-healthcare domain, everybody understands that all these things are necessary, and everybody understands what is their why. Of course, in the healthcare context, that is largely to do with getting optimal patient care or achieving the operational efficiencies. And whether the operational efficiencies comes in the form of a number of patients served in a particular day or a waiting time for a particular patient. So depends on what your why is. I'm sure everybody understands what are the imperatives, what are important to them. Why we are discussing this topic today is because I personally believe that we are going through a massive change for healthcare in India, and it is very important for us to face those key challenges, right? Whether it is complex workflows which we are feeling, the busy times which we are going through, or our different stakeholders' needs, whether it is a patient need, whether it is our doctor's need, or whether it is an organizational or our investors' need. And as I say, our current trend, or a lot of the people have already started talking about, data analytics and technology integrations, and of course, everybody has started their journey in a big or small way. When we talk the performance management in this domain, I think we are very clear that what we need, or HCH as a business was very clear what we wanted. We wanted improved outcomes for our patients. It was very much goes in line with Dr. Clive gave examples of negotiables and non-negotiables. Ultimately, everybody is in this business to improve patient outcomes. As a business, whether you are in a profit sector, non-profit sector, the cost reduction and cost reduction is not only the cost, but also about eliminating waste or reducing the efficiencies is a key component. And when we talk about reducing inefficiencies, it is equivalently important for us to streamline processes and build up on the learnings of the reduction and build up better practices. So once we are all clear with the idea of what exactly performance management mean for your particular organization or for your particular department or your particular employee, then everything starts becoming easy, because what you have largely done is you have identified why does it matter to you, what you need to do, or what is it that you need to get out of it. I think what we will talk about quickly is the 4 key components, which actually answers the how of performance management. And whenever we talk about any kind of performance management, everybody has a goal, right? So whether these goals are in forms of, as I say, reducing the waiting times or improving on the errors, or measuring a particular KPIs, or getting some kinds of feedback and creating analysis out of it. And then how do we put together those pieces of the system so that we have an integrated outcome? So when we talk about a goal setting, let's say I'm an HR person and I'm setting a goal for a particular individual of mine in my healthcare organization. It is going to be very important for me to understand what that person needs to be delivered. Vis-a-vis, if I am a CEO of an organization, it is equivalently important for me to identify what matters to my investors, and whether my performance matrices are answering those needs. So depending on where you are in terms of organization, whether you are part of a quality team, whether you are a part of a HR team, or whether you are just a manager or a senior manager, goal setting for a particular activity, it becomes very important. And of course, once you are clear with your goal, there is plethora of information available as to what kind of matrices or KPIs you should be measuring. And once you collect the data, it's all about understanding those data, analyzing them, and integrating for you to get better at efficiencies or whatever your goals you had defined. So once you collect all these key components, and this is largely talking macro, assume that a macro who is let's say a very senior manager or a CEO of an organization, and for that person to build up a performance management system for an organization, that person probably will start with the organization's missions and visions and values, etc., etc. But technically, if you are a manager, you would probably go through the same process of need assessments or goal settings or KPI selections or implementation and evaluation. So technically, whether you are required to be delivered on the macro objectives of your organization or micro objectives of your organization, you will go through the same step-by-step building process for the performance management. Once we know that I have all the blocks available for that performance management, the the key challenge everybody faces, that how do I implement this? Because as we become big in the organization, or as we have resources available, Dr. Clive mentioned, whether you have, with deep pockets, whether you have 4 resources or whether you are not with deep pockets and you may not have many resources, some stakeholders will align, some stakeholders may not align. Then the tools which you will have available to implement. So I think depending on where you are in terms of your journey, by and large, you will have to tick mark each of these 4 boxes on the screen to implement a successful performance management system. What is essential is to involve all the stakeholders in any performance management system, whether it's a junior employee, whether it's a senior employee. If it affects them and the work they do, it is very important to get their engagement. It is very important to keep training and educating continuously. So it's not a one time activity, it's just going to be continuous. Of course, we in turn we have to design the tools to provide the feedback and keep doing a continuous communication to either the people or to ourselves, whether we are heading in the right directions. And of course, we have to do continuous analysis of those so that it can put us in the right direction. So once you tick all these 4 strategies of implementation, perhaps it will take you in the right direction towards your ultimate journey of saying that I manage the performance of my organization. When it comes to matrices or KPIs, for a healthcare organization, we measure something called as, or probably hospitals measure something called as readmissions rates or medication error rates, or in our particular case, we measure net promoter scores and things like that. So what is important is to identify what those goals mean to you, how you are going to measure that, and in order to measure that, what are the systems, forms, technology, feedbacks you are going to put in place. And once you have all that data and information available, how you are going to make a sense out of it in terms of insights, in terms of quality imperatives, in terms of outcomes, in terms of projecting as to how your journey has been, whether you improved on some of those matrices or whether you are still there and you need to do further more work into each one of them. So I'm sure once you start looking at the relevant models, you will be able to find a lot of information available. But if I was to just talk by and large on the journey of HCAH, and on the right hand side, these are the things important to us. These are our performance management KPIs. These are our key sets of priorities within our business, right? So when we talk about our performance management, we talk about patients first culture across the organization, and because of that, the positive feedback from every patient matters to us. And hence what we started measuring is something called as net promoter score. So our net promoter scores are continuously upwards of 65%, and globally not many organizations have this level of score. So this is something very close to our heart. This is something which we monitor day in and day out, and learnings which we make out of this results into our overall performance management system, whether we define something at an employee level or whether we define something at an organizational level. All these things provide the result towards the net promoter score, what we measure. So I'll stop here briefly, and if you guys have any questions, I'm happy to answer those questions. Thank you.
Any questions from the
Thank-
audience? I would like to ask a question, Mr. Gaurav. As an organization, have you been implementing any PMS frameworks or any tools or anything built internally or any other third-party platforms or software or tools or any programs. I just would like to understand globally, this PMS frameworks are being developed, getting done slowly now. I came across Public Health Foundation in US, which is a NGO, not-for-profit organization, has developed a framework for performance management system. So I just
Sure.
wanted to understand, or whether you're developing something in-house and working towards. I was just looking at your screenshots that you've shared, actually.
Sure. Yeah, I think, ma'am, the answer is yes. I think no organization in today's world can get away with not monitoring those key imperatives. I think at different levels of our organization, and when I say at different level, it is not about an senior employee versus junior employee, but it is about whether a department needs to deliver on certain objectives. So we, as a business, have evolved with a concept of OKRs, which is called as objective key results. Now, this is something which puts us in line. It gives us a mirror almost every week whether we are heading in the right directions, and this is synced with our annual operating plan, or we call it actionable operating plan for the year, right? So by setting the targets or the goals very early in the year, and breaking down those targets in a meaningful way, which we need to achieve month on month, sort of keeps us on the track from a delivery perspective in terms of our goal. So that is one example. The second example, as I cite, was the net promoter scores, right? So every patient who comes in HCAH gets, upon discharge, gets a question asked whether they would refer our services to somebody else. And this is how the companies like Apple's of the world operate. And from our CEO to our lowest quartile of the people are responsible to read those feedbacks on a daily basis as they come in. And we are very much finicky when it comes to patient feedback. We want to make sure that if something is not right, how fast we can correct it, and how do we achieve those correct feedback. So something which we aggressively monitor. And of course, beyond this, we already have the tools of when it comes to HR, when it comes to setting up the goals for any individual on a yearly basis, and then something called as a monthly screening for each of the manager, which is largely 360. So by putting up these right elements in the place, we've been able to drive the behaviors of our organization and our people.
Right. Maybe it is time for accreditation bodies like QAI, with all the quality stalwarts like Dr. Clive and representatives from industry forums, to start creating a voluntary framework, at least in the country, a performance management system framework for the industry to adopt on a voluntary basis. How do you align and integrate a lot of your other improvement metrics or tools or your practices into your assurance framework? At the end of the day, the assurance on quality, assurance on safety, assurance on performance, everything needs to be integrated. Maybe it's time for a different management system framework to be developed, and maybe all of you can put some efforts. I will request Dr. Anna also to look at it and take the sectoral performance to the next level. Somewhere it is stuck at that quality as a compliance, and it's not moving beyond that. And it requires a certain business maturity for organizations to internalize all this. So with that, I would like to see if any other questions are there from any audience, please.
No, absolutely. And I would just add it here
Yeah.
is we are a very proud QAI accredited organization. We believe that those standards have helped us to get into the right track. I think when we largely talk about those performance management system, I think it is also about words like whether we are audit ready at any given point in time, right? Whether if you are so I think this is what we are focused as an organization, and all our thought process sort of works into that direction. So thank you for this insight from your side as well. Thank you.
Thank you. Thank you.
Thank you so much, Dr. Mr. Gaurav. We enjoyed the session. Moving on to our next speaker, Ms. Neha Lal. Ma'am, are you there?
Hello.
Hello. Good afternoon, ma'am. So, Ms. Neha Lal, she's here to give her insights on healthcare quality status quo. It is a compliance tool or a performance improvement tool. So, I request her to kindly give her insights on the topic. Over to you, ma'am.
Good afternoon, everyone. I hope I'm audible. I'm clear.
Very much, you
Hello,
are
Dr.
audible, yes?
Shiv. Hello, ma'am. How are you?
All well, thank you. Thank you for joining us.
Thank you. So, the topic is quite complicated. It's about status quo on the healthcare quality, whether it's a compliance or performance tool. There is a buzz, and there are a lot many things to talk on. I have not prepared any of the slides. Rather, I would just like to give some ground level examples so that the audience and the members are pretty clear that what are we and how the healthcare quality is, emerging. It's emerged rather, but it's a lot to do in the Indian healthcare context. So I'm going to talk on both the perspectives. First, let me start with the status quo thing between the compliance and the performance improving. Let us take an example that whenever we talk about any compliances which are enforced by the regulatory authorities, which are like, your licenses, your necessary approvals to make the structure ready to operate. So that is something which has to do with the, I would say in a simple language, it's a license to operate. So whenever any building, any infrastructure, we call it a healthcare infrastructure, there are a number of compliances which we have to meet with before even we start into the operation mode of it. And that applies not only to healthcare, it applies to all the industries. Say, for example, I think compliance is just a mere framework for the quality improvement. This is just a basic thing to do when we talk about even the quality. Quality is, in my opinion, quality is equal to excellence. When we talk about something which is so excellent in its nature, I think that is something to do with the quality. When we talk about only the compliances part, that is nothing but the basic requirement, basic prerequisites while operating the healthcare system. So there should not be any status quo. I think people at large must understand. My submission to the small nursing home and the emerging hospitals, that these are the thing after having your Clinical Establishment Act applicable at almost all the states. These are so imperative thing to do in terms of documentation, in terms of acquiring the license, acquiring your approvals for XYZ. Say for example, the biomedical waste management. Say for example, your pharmacy license, your X-ray license, your ARB approval, your leaf license, so on and so forth. So these are the basic thing to get started. And then probably we can get into the quality journey. So when we define our own standard, any accreditation body you take, first foremost is the compliances part, without which one cannot even apply for the accreditation. So people have to, people will have to understand that this is just prerequisite to start the game on the quality improvement. While doing so, first you acquire the license, first you acquire the compliances, that is fine. There is a checklist and you just acquire license and tick it off. That is something, it's just a first or second step. And then the whole quality journey starts. So when you get into the accreditation, because accreditation is the only tool which apply for hospitals for quality improvement. So may the quality journey then be based on your license and approvals. When you have structure ready, when you have SOPs ready, and then how you are operating, and there is too much to scope for the improvement. I believe the accreditation and the quality framework, provide an opportunity to improve the quality, be it how to do the ECG versus how to make the discharge process done in time, or how to reduce the medication error. So these are a lot many points. The emerging thing which I would like to portray here, working on the projects of Adani now, a lot of stuff, lot of processes are now being taken over by the technology and the automation, wherein all this quality journey processes or whatever manual documentation or whatever manual attempts are being taken care of. I think now that is switching gears with the technology. And I believe, and I'm a strong believer in adoption of the technology. I'm not talking about HMIS or EMRs of the world. My submission to you is everything. I was just going through one video yesterday that was AI in pharmacy, which was just a fabulous automation system where the robots are there. And when you just punch in the entry with the prescription, then you are just, punching the bill and then done. And then automatically the command actually pass it on to the robot. They pick up the right drug from the rack based on the QR, the right dose, the right drug, they pick it up and then they deliver at the deliver counter, and then that is automatically packed. It's packed with the patient UHID, and everything is, the cross checking and everything is done, and then it's delivered via the pneumatic system to the patient's room. So this is the whole process. It was so fascinating solution I have ever come across. There is no chance of any dispensing errors. There is no chance of any prescription error. There is no chance of any transcription error, nothing of that sort. And that the similar thing even apply at the ward level when the nurses have to feed the medicine to the patient. That is about the administration. So likewise, the compliances is the basic part. The another is the whole quality improvement journey, and the third is automation technology. I think in India, we must now look for the technology which are going to be there 10 years down the line in any kind of hospital. These are such a simple tools, very cost-effective tools are available in the market. The younger generation, those who are coming from the IT background, the young students of mine, I think I always tell them that whatever you are learning right now as an academic, as academia, I think there is going to go. The time has to come, and time will come where all these manual thing, whatever you are doing in the hospital, that will have to be upgraded with the technology. So more and more we are aware of, more and more we are, open-minded to explore the newer things in healthcare. Look at other countries. I've just been to the Singapore. I've just been to the Mayos of the world. I mean, the amazing infrastructure, amazing technology. And in India, it's a game. Why? Because we have the volume. We have the volume to have even the return on investment, whatever investment we are going to make in technology. So there is enough and more out there in the world. Maybe I'm really thankful with the QAI because when we are talking about this, the accreditation has come into the market, about 2006, and we are still into 20 years. But then in India, the technology piece is actually, running at so faster pace. I believe that if we explore more, if we adopt more, I think the quality improvement journey becomes so easy, error proof, and our so manual efforts will take into class. I want to see the future in the hospital where the training status quo, sorry, I'm a little diverting, the training part where we have to motivate the members, we have to motivate the people to come and attend the training, and to participate. And then we just think about the nurses and doctors. Doctors are so busy, nursing have a higher attrition. We always rope them into training just to make that happen, just to make that medication error or HAI monitored, just to make poor nurses to just do the documentation. I mean, infection control, say for example, safety parameters, safety indicators. Given all of these, I think there are a lot of many solutions which are there, taking your manual documentation, manual efforts to the technology piece. So I think there is a lot more to do. Let us even not talk about the compliances, which is something very old stuff according to me. That is something is so required. It is like to drive the vehicle, you need a license, boss, without which you can't drive. So that is something is already done and dusted as per me. There is a whole quality improvement journey which accreditation has already taken place. We all are doing it. We are quite oriented about it. So many manuals, so many procedures, so many audits, assessment we have come across. I think the third large piece going ahead with, it's a technology. So technology, I'm not talking about the only AI, and I'm not talking on spending on technology. I'm just requesting and urging everyone to orient themselves that what is going to be the future. And I think that way our quality journey is going to be more fruitful and more productive. So these are the summation. With that, I would like to answer, and happy to answer if any questions. Rema, over to you.
Thank you, ma'am, for hitting on the topic so well. So let me just see if there are any questions.
There's one question in the chat box, I think, for Mr. Gaurav, I guess, and even Neha also can answer one of them. Couple of questions in the Q&A box.
Yeah, sure. 1 minute. All right. If the robotics given a prescribed medicine means there is no prescription errors, if we implement that automation system means, what is the use of implementing clinical pharmacy practices in India? This is from Kamili. I'm not getting your questions. You are asking that what is the use of implementing clinical pharmacy practices? 1 second. So when we talk of Kamali, are you there? You can hear me, right? My say here is that we are not talking about. Let me relate this with robotic surgeries. We are not talking about shutting down the medicine and surgery whole day and switching gears to the technology just for robot to perform surgery. No, these are all the assisted tools. We are not asking to rely only on the technology where, we are just asking the technology to help us with wherever any human intervention can be minimized, and thereby we can achieve the efficiency and reduce the errors. So the example which I, because that was so recent, the example which I gave about the robotic and AI in the pharmacy was more to do with the, I would say, motorized or more to do with the process itself, just to, it's not about clinical pharmacy, but don't you think that clinical pharmacy is also getting wasted just merely the taking out the medicine and reading that out and again cross-verifying with the prescription and then dispensing? I don't think the clinical pharmacies should ever do this. Clinical pharmacies has more role to play in terms of about the pharmaco and therapeutic and whole medication management. Look at other countries. The pharmacies are so much so valued, and they have lot much of empowerment even to treat the patient sometimes. So I think this part is something very different. The part which I'm talking on the technology and automation to do with just the assisted process, the assisted whole modus operandi in the hospital. I hope I've answered you.
Yeah, there is another question. How can healthcare organization leverage technology to improve healthcare worker satisfaction while minimizing the risk of technology fatigue and maintaining a focus on quality patient care?
Of course, I mean, what if I give you the example about the nurses, because I always talk whenever I go to because the hospital, 70% of your manpower consisting of nurses. And they do everything when the patient is admitted. Even the patient is feeling cold, you call nurse. Even the patient is not liking the food, you call nurse. You need certain medicine, you need the attention of the doctor, you call nurse. So believe, in the patient's room, we are only relying on nurse. However, the nurse is so important resources for the hospital. They are so technical. They are only to be used for the patient treatment and nothing else. But then also we embodied with them with so many other activities. What if the technology is there where there is a smart room available? Why those functions are taken over by some of the technology? I'm not saying manpower. I don't want you to, have the patient care assistants all around. I'm talking that if you have the technology which is taking care of your temperature, which is taking care of food, which is taking care of your other administrative and support service parts. Say, for example, there is no hot water coming in the bathroom. What the poor nurse will do about? Nurse is also called the maintenance guys, right? So all I'm saying is the technology can be placed wherever we have non-clinical, non-technical things to do. Thereby, we can always increase the satisfaction. Your manpower also will be, will be valued. You can make use of them, the proper use of them. The productivity of the work can go high. Say, for example, the doctors, they are using the technology like anything. They are so fascinated about the robots and all AI solutions. The radiology, if I'm typing the sonography report, automatically the template comes. Is there any error? Then there is the AI which talks between the image and between the documented report, where your report is not getting compliant with your. So there is a lot of subjectivity has to be removed. Say, for example, I'm going for the sonography. I'm only comfortable with the ex-radiologist because I think she is doing better with her knowledge and expertise, but another radiologist is not at par. So in radiology, there is always this, likewise, there are so many things which are subjective in this matter. And by bringing in the technology, of course, the quality, the uniformity, the standardization of the care can be improved. Say, for example, my prognosis is saying that I have XYZ. Automatically, the treatment comes into the order that if I have this many symptoms, this could be the probable mode of treatment, which is assisting to the doctors. So with the technology and AI, we can bring in standardization, uniformity, and thereby we can increase the satisfaction. The quality of care can be improved, certainly.
One more question, Rima, just come down. One or two more questions.
No, I think
Sivadurga has one. Did you see this, Rima?
No, ma'am.
This is to
Only
Mr.
Dr.
Gaurav. I
Tushar.
guess this question was to Mr. Gaurav, I think. Maybe. Any suggestion on how to fastly enhance quality in healthcare settings worldwide, anonymously in future perspective? This question from Sivadurga. How to accelerate or enhance quality in healthcare settings worldwide, anonymously, from a future perspective in India? Maybe it's acceleration of healthcare quality is what it is.
if I may answer, madam, but
Yeah,
then I think
please.
so quality has just started taking a shape since the accreditation has come into the Indian healthcare. If we talk about world as a whole, these were the standards even written on WHO. See, for example, everything is now leading into WHO. With the accreditation, lot of many standards and objective elements are derived from the WHO. But the healthcare being a country subject, and in India, it's more of a state subject. I think we are falling apart, and we are not, adapting it as it is documented unless and until the compliance part comes into the place. So if you talk about the healthcare quality, is a huge journey, but then slowly and gradually, if now clinical establishment, I'm happy that at least the states are following Clinical Establishment Act, and at least we have the framework at least. So framework to start the nursing home, frameworks to start hospital, and couple of approvals before getting into accreditation. So when the accreditation becomes mandatory, like any other country, then I think that will be a game changer. Wherein, at least PMJY has started that momentum wherein all PMJY hospitals should have at least pre-entry level accreditation, which is a fair call, and thereby we are ensuring that healthcare quality does take into consideration when it comes to healthcare. So slowly and gradually things are moving, and we as a healthcare professional, we always wish for that everyone should take these on a positive note and cooperate to the fullest way, so that we all can achieve a lot many things together. This is onus on us as a healthcare professional that we should do it, being in this industry.
Same question. Can we? This is actually question to Mr. Gaurav. Mr. Gaurav is available. We can also request him to answer this. Rema.
Yeah. Mr. Gaurav?
Till Gaurav comes in. Okay. I said
Dr.
till-
Clive is also there. Then we will
Yeah,
also.
I just heard this, and I was just thinking, I said, what is this question? Any suggestions how to fastly enhance quality in healthcare? Very simple, very simple. It is the mindset. Why is quality treated as something that has to be done only during accreditation? So, there is, you'd have to do something because you have to do something. It is pure and simple as that. COVID time, we washed our hands in our sleep also, क्योंकि डर लग रहा था. अभी नहीं लगता है. So this mindset has to be there. जैसे मैंने दिखाया था, the red light syndrome. Till people don't stop at 4 a.m. They stop because of the man, not because of the light. The red light was the quality, and this policeman is the accreditation. So this concept we have to remove. It is a very simple thing. We can give a lot of theoretical books to read on this. It is the buy-in from everyone. And what is quality? I'll end with saying quality is doing the right thing 365 by 24 by 7, comma, especially when no one is looking. ये बात हमको समझ में नहीं आती. If no one is looking, हम करते नहीं है. So fastly enhancing it is, your mindset. Change the mindset. 1 say 2, 2 say 4. And I'll hand Gaurav can, take it further.
No, I think I completely echo with you, Dr. Clive. I think a couple of more things I will just about what you said was beyond the mindset. What I would add is one thing, which is the discipline, and secondly, leapfrogging. Because discipline in a context that when I decide that I want to do something, getting those compliances in place and adhering to them with a strong discipline is a very important part. And secondly, for a country like India, it is very important to leapfrog from where we are, looking at the global models. So how do we, and that's the only way to fast track this whole journey. So I think that's where I would end my.
And Tushayu is asking why quality does not find
Mm.
its way into medical education. Dr. Tushayu, you write to NMC, but I think now they have started putting some, some modules. But 100 baat ki ek baat ye hai, Dr. Tushayu doing the right thing without anyone looking. This doesn't have to be taught, in medical school. We have been so used to the shortcut and the chalta hai attitude. It is coming now. It is coming into medical education, but they'll teach you quality there, Tushayu. Doing quality has to still come from within. And yeah, but it is finding its way. It may not come in the speed and the quantity you think, but some things have started. Yeah.
I just wanted to ask a question to all the three speakers. In the era of technology, AI that we are talking about, machine intelligence, machine learning, is this AI in quality assurance, quality management started happening in healthcare? At least we are seeing these conversations. We have our next session next week on BFSI, which is actually on AI in quality. I just want to understand, are you seeing AI making inroads into quality assurance, quality management systems? Do we need it?
What is AI in quality? I still don't understand.
Mm.
I'll tell you one thing. At the end of the day, every new solution, Rama madam, will come with its own set of problems. So you can say AI, you can say quality, you can say, but it's all machine learning. It takes its time to learn. And I still really don't know what this is. I won't be able to comment much on it, but I'll just tell you, with technology, what I've learned, every new solution will come with its own set of problems. So I'll also log in next week to hear what they have to say.
From Neha and from Mr. Gaurav also.
If I may have to opine, yes, I think there are a lot many institute now in India. All the IITs are making a center of excellence and healthcare campus within their campus. So now IIT and healthcare coming into foray. We also receive a lot of proposal. I happen to visit IIT just to understand where the physician, scientists, and doctors are working together and creating a prototype where the science and technology both coming together. There is a lot of fund which has been lot of fund and budget have been allocated from the of technology sector only for the healthcare. So if you read about it, the budget entirely from the central government to the technology to invest in healthcare, because healthcare is going to be booming. There are so many startups, there are so many NASCOM and other industries. They are closely working with the IT companies and the IT engineers to find a solutions for the healthcare. There are students on conventional masters in healthcare management. The institute and the college and university take the IT students first to learn the healthcare management. Now the time has gone, because if you see the breakup of the students' background and demographic, most of the IT students are getting into the healthcare. Why? Because there is a opportunity. The CAGR on healthcare capita and as a spend is increasing rapidly. By 2050, I think the CAGR is going to be increased by 12%. So that much of potential what we held in our industry. A lot of opportunity, good platform, good investment coming in. You are seeing nowadays every day there are 3 news, not less than 3 news which I read about healthcare in any newspaper. Be it a merger acquisition, be it AI, be it technology, be it any research and development. Lot many things are being done in India on the research front as well. I'm not talking about the clinical research. I'm talking about the research as a health, as a subject, and research as a, I'm talking about even the non-clinical research where the data are there. So there is a clinical data and how that research are happening. Everything comes with the technology. I think technology and the data is the future. And in my world, data is a new money. So there are ways and means how to monetize the data in the hospital and in the healthcare also. So there are enough and more. When I talk more with the technological guy, I think technology piece is actually flourishing. So this is the future. I totally believe in this. And I allow myself to adopt and read more into it so that we can make a better future. Thank you.
Mr. Gaurav?
Yeah, I mean, I have a very strong positive perspective on the AI when it comes to healthcare. I think for a country like India, AI would create, and it's already creating. I mean, whether it is reducing the wait times in a hospital to making sure that drawing large level of from a large level of data, drawing some specific insights to making decisions in certain kind of algorithmic way. I think AI is playing already the part. I mean, for a company like us who is very much looking forward to technology in terms of building up an out of hospital care network, for us as for example understanding where do we draw the clinical line where a person needs to be in a hospital or versus a patient can be supported out of the hospital. It could be a decision of an AI driven algorithm. And hence, I think my perspective on this is very much positive. I look forward to newer interventions which can be done. I mean, as a business, what we've been able to do is we've been able to take all the point of care devices which operate on AI to very close to the patients. Otherwise, they would have been required to visit, care centers in a metro cities or otherwise, right? So I think there are opportunities with AI which we need to sort of embark upon with open hands at this stage and gradually build upon that.
Rama madam, before you end, I want to make, so that it should not sound that I'm saying there is no role for AI and technology. There is a role, everybody knows it. It is about, what it will come with. And, we have to, it is as simple as that. Any fool not worth his salt would say there's no role for technology because technology is there. But I'll just give you an example. The mindset to adapt that technology. We have something says so simple as an IoT, the Dozy. Now I have to put a star right here. I am not a promoter of Dozy. I'm not doing anything for them. They have, those, pulse, BP, everything can be, it's below the bed. You don't have a nurse coming there. And it is going into the system and coming in the file, but still the physician says, nahi, ये इसका कुछ पता नहीं. It's an FDA approved device. The physician still says कि इसका कुछ पता नहीं. I want to see the nurse one. So although technology is there, FDA device, advanced thing, giving you so many things, the physician mindset or the mindset is still not there. So the whole reason why it had come to reduce a person's work is not there. So, technology helps, but the buy-in has to be there. And at the same time, there are going to be challenges which come, which we will see.
No, and I completely agree with Dr. Clive. I think India's approach to, let's say, digital payments is a classic example, right? I mean, we were a country where majority of the transactions were dependent on cash, and I think we gradually see a shift, and now we are presenting ourselves as global leaders in the segment. So I believe you're absolutely right. It is a mindset thing, but I think while it can take some time, it is for us to pilot out newer things and really scanning the market as to what could be deployed in the Indian market faster, so that patients become the beneficiary of the same.
Yeah.
Not even talking about AI from a complete healthcare perspective, very specifically about AI in quality assurance, quality management systems, which has actually started happening in other sectors and other domains. Maybe that is the confluence between the human intelligence and the artificial and machine intelligence is what we need to kind of reap the benefits out of the whole engagement. So AI in quality assurance, AI in quality management systems, compliance is something which again, all the stalwarts and experts can start creating in that specific niche, and it's all encompassing. It's not a particular function or a domain, as you know very well. It's completely horizontal when we say quality. So how do you start looking into AI in quality? Something I just want you all to think about, and then maybe educate us more in the long run with a couple of more sessions and series. This is something which is being discussed in other sectors.
Yeah, I think I totally agree. Very important agenda which you have raised. There is a lot to do, and when we go deeper down into quality improvement, how the
Yes.
AI is playing a role just to improve the quality, so that
Yes.
the journey which takes a lot of pain and a lot of efforts while taking that accreditation and quality improvement to the next level, how the technology and AI will act as an enabler in that particular journey. It's very important thing which you have raised. Yes, I think we equally should think about it and deliberate more and more. Thank you.
That's all it is from my side. Two points, key takeaways from this session. Rema, again, please make a note of it. And Dr. Rana, please discuss. One is whether the sector will start working something like a performance management system, a framework, or a document, or a guideline, or whatever it is, something as a PMS framework, something can be considered. AI in quality, whether you all can come out with something as key takeaways for the industry. And all of you are from the industry, so which will benefit the industry. Maybe QAI can look into all those. With this, I just want to stop. So so this is the wish list from the conversation. And please go back to Dr. Rana and see that, at least you're doing so much of knowledge series and to educate and create sensitization in the industry. Maybe you can look at these aspects also. That's all. Thank you.
Definitely. Thank you so much, Rama ma'am. So one thing that you mentioned was AI and accreditation, AI and standards. So that will be very interesting to see how accreditation standards are going to reform while talking about compliance in terms of AI and technology. So yes, very interesting, and we are going to take up certain topics in our upcoming future events. So I hope all our distinguished speakers, they had a wonderful time with us, and we look forward to working with you in such events, such sessions in future as well. So kindly keep in touch. Thank you so much for your time, everyone. All the audiences for keeping patience throughout 1.5 hours. Yes, it is. I see it's going to be 4:30. Thank you so much, everyone, for joining. With permission of Rama ma'am, we would like to close the session.
Thank you. Thank you.
Thank you so much.
Thank
Thank
you.
you.
Thank you.
Thanks.
Thank you,
Bye.
QI. Thank you, Rema. Thank you so much. Bye-bye.
Bye.